All right, let's take a look at a few of the muscles and some of their muscle actions. We'll be looking anteriorly, considering a position of anatomical position where the palms are out flat in front of us and they're supinated like we're holding a bowl of soup. And we'll just run through a few different muscles and some of their actions. This isn't comprehensive, but it will help you just get your bearings and see what some of these muscle groups do as you're working through some of your different exercises. So let's start with thinking about breathing. If we think about breathing, we think about the internal intercostals. So costa is rib. If we're in between the ribs, we're intercostal. We have intercostal, internal intercostal, and external intercostal. Then we also, underneath the ribs, going all the way back to the spine, is our respiratory diaphragm. So the respiratory diaphragm and the external intercostals would help us to bring air into our lungs or take a deep breath. Our internal intercostals with our respiratory diaphragm would help us push air out, and that would be an expectoration. So if we have inspiration, we're using external intercostals and respiratory diaphragm. If we have expectoration, we have our internal intercostals and our respiratory diaphragm. Let's say we were riding a horse. We would get on a horse, and which muscles would hold us on to the horse? They would be these muscles in the medial portion of the thigh that would help us stay onto the horse. And if we consider the body midline as the point that we're thinking about muscles either moving away from or moving back to, if we move away from the body midline, then we have an abduction. So if someone's abducted, they're taken away. Then when we bring the muscle back to the body midline, that's an adduction. So these muscles in here, the gracilis, the adductor magnus, adductor longus, pectineus, these are adductors that would help us, for instance, keep ourselves on a horse. The other muscle that we see here back posterior to where sartorius has been cut would be iliopsoas. Iliopsoas doesn't necessarily participate in our adduction, but it is a key hip flexor that we're interested in. Let's consider, for instance, touching our chin to our chest. One of the major muscles within that effort would be sternocleidomastoid. So coming from the sternum, the clavicle, that's the origin, and then going up to the mastoid process, that bump that you can feel underneath your ear, that's sternocleidomastoid. And that would help you touch your chin to your chest. If we were, for instance, standing on our heels and we wanted to go ahead and stabilize and dorsiflex. So dorsiflexion, bringing the top of the foot or the dorsum towards our shin or our tibia. If we were doing that, or plantar flexion, if we're pointing our foot, we're using this posterior compartment. So dorsiflexion, if we're stabilizing ourselves from standing on our toes or on our heels, that actually is just helping us stand upright, then that would be considered dorsiflexion, and what we would be interested in helping us do that would be tibialis anterior and extensor digitorum longus. And TEPS G, tibialis anterior, extensor digitorum longus, peroneus or fibularis longus, soleus, and gastrocnemius. That'll take you all the way around the compartment of the leg. Then if we think about, say we were going to grip a knife, so we were going to hold on to a knife, which would mean that we would flex these hand muscles. Then we would be flexing these muscles here, and this group of muscles is known as our flexors. So our flexors then would help us, for instance, hold a knife. If we were going to do sit-ups, and we would be bringing our torso closer to our thighs, we would be using some iliopsoas, so we would be tying that in. We'd be using our external and our internal abdominal muscles as well as our rectus abdominis. So 4 different abdominal muscles. Our external abdominal oblique just means it's diagonal. our internal abdominal oblique, it's at an angle, our rectus abdominis, and then deep to all three of these is transverse abdominis running this way. So when we're doing a sit-up, we would be using iliopsoas, the external abdominal oblique, the internal abdominal oblique, and rectus abdominis. Let's say, for instance, we're going to drop our shoulders. So we're going to drop them down. One of the muscles that would be tied in with that would be tying into the coracoid process of the scapula, and that would be pectoralis minor. So pectoralis minor is deep to pectoralis major. So pectoralis minor would help us lower our shoulders, or really lower our scapula in particular. Let's say, for instance, we're sitting cross-legged. We want to turn the soles of our feet to face each other. If we were going to do that, then that action would be called inversion. And for inversion, one of the muscles that we would use is actually tibialis anterior. So we would use that to invert our feet. If we were going to nod our head to signify no, we would be using some sternocleidomastoid, and then that would be anteriorly. And then if we were going to also take a look at what we're using posteriorly, we're going to be using some splenius capitis and some trapezius. So splenius capitis, trapezius, and sternocleidomastoid would work in opposition to each other to help give us a no head nod. If we were running and we're considering some of the actions at the hip joint, so here at the hip joint, we would be interested in what's happening here. And thinking about that, to stabilize the joint, we would be using gluteus maximus. And then we would also be using gluteus medius, which is in this area. And then deep to all of that is gluteus minimus. So we have a little bit better view of those over here, to where we would see gluteus maximus helping tie in, gluteus medius tie in, gluteus minimus is deep to gluteus medius. Then within this, if we were thinking about, also we'd be using the hamstrings. So the three different hamstrings we're interested in, we have biceps femoris, semitendinosus is on top, so tendinosus is on top, and membranosus is deep to tendinosus. Some people remember membranosus as it being more medial. So the three hamstring muscles, biceps femoris, semitendinosus, and semimembranosus. Those are going to be the three hamstring muscles that we're focused on. So between the glutes, maximus, medius, minimus, the hamstrings, those are actually helping to go ahead and stabilize the hip joint. We also amazingly use even more. We swing around anteriorly and take a look also. Iliopsoas is helping us out. And then we also have rectus femoris, one of our quads. So quadriceps femoris are four muscles: vastus lateralis, rectus femoris, vastus medialis. And if we took off rectus femoris, deep to it would be vastus intermedius. We also use all of those adductors. We use sartorius, and then we also use tensor fascia lata. So tensor fascia lata is a muscle here that tenses the fascia laterally. And the fascia that is lateral is the IT band or the IT tract. So a lot of muscles involved in running and the actions at the hip joint. So we have lots of flexion anteriorly, extension posteriorly. We're stabilizing it with all of these adductors and then also these abductors. So a lot going on in stabilization of the hip joint. If we were to kick a football, the actions at the knee joint, so we're focused on the knee, would be to align and stabilize the joint. So we would look at the quads being tied in with that. So the three vastus muscles, lateralis, medialis, and intermedius, deep to rectus femoris. 1, 2, 3, 4. So those would help to go ahead and extend the leg, keeping in mind these are our thighs, these are our legs. And so our legs are our tibia and our fibula, our thighs are our femurs. And so we would be using the quad muscles, and then we would also be using those muscles posteriorly for within our hamstrings that we would be interested in particular semimembranosus and semitendinosus, the T being on top. So those would help us in the actions of kicking a football. If we were to place our hands, our palms in anatomical position, if we were looking at that to go ahead and put them in anatomical position, anatomical position would be a little bit more like this. This model just has them somewhat supinated partially and then completely flexed and somewhat pronated on this side. So in anatomical position, if we were placing our palms in this position, we would be supinating, and so like we're holding a bowl of soup. If we were going to place our palms in anatomical position, we would be putting our palms, say, from a prone position to supine. The muscles that we would use for that would be partially some of our biceps brachii, but mainly we'd be using a muscle that's deep to brachioradialis, and that muscle is called supinator, so it helps supinate. And then we would also be using some of our triceps brachii and our extensors as well. If you hunch your shoulders, if you lift your shoulders up, we're going to be using trapezius and levator scapulae. So levator scapulae is one of those nice muscles that the name tells us what it does. So levator scapulae elevates the scapula. And then trapezius, these superior fibers also help within that. If we were to point our toes forward or plantar flexion, we would be using gastrocnemius, the teardrop muscle, which is actually fairly thin, to its deeper partner soleus, which is the actual bigger muscle of our calf muscles. Then if you shrug your shoulders, which is similar to hunching your shoulders again, trapezius, those superior fibers, and then levator scapulae. And then if we take a look at bringing our arms straight back at the shoulder joint, as in swimming, so this would be this extension of the shoulder joint. A major player in that is actually going to be latissimus dorsi. So we would think about that. If we brace our arms when we fall forward, we're going to be using our triceps, our extensors, and a fair amount of deltoid. If we think about closing our jaw, as in chewing, the major muscles that we're interested in are the temporalis muscle and the masseter muscle in here. Let's say that we move our thigh laterally, so our thigh comes out, and that is an abduction. We're taking the leg away. Then what we're going to be looking at for that action is going to be these lateral muscles that are helping us abduct, and those are going to be gluteus medius and tensor fasciae lata for the most part. And finally, just some muscles that are kind of hard to see on this particular model, but in our pelvic diaphragm here in the pelvic floor, we have muscles in that pelvic floor that would help us do Kegel exercises, which are the exercises that you would do, for instance, right after you finished urinating. If you go ahead and have that last squeeze of urine, that's actually flexing the muscles of the pelvic floor to give that final push of urine, and effectively that is a Kegel exercise. So the pelvic diaphragm is where all of those muscles are held. So this is just a real brief overview of just some of the muscles of the body. Hopefully that helps you.